COVID-19 Part 4. What should I do if I think I have COVID-19? Hello, residents of New Columbia. My name is Val, and I am a third-year nursing student from UP. As we have the honor to be working with your community this semester, please feel free to contact us for questions, comments, or concerns. You can reach us through your resident services or at hfnc.upson@gmail.com. Before we begin, I just wanted to mention, experiencing a pandemic is hard. For most of us, it's the first time we're ever experiencing anything like it. Everything we do has to accommodate for COVID-19 risks, and it can be stressful and take a heavy toll on our well-being. Make sure you take time to take care of yourself. Stress can become unhealthy and dangerous without proper coping. More information can be found on this CDC website, which I will also link down below in the description. Without further ado, this is the fourth video in our COVID-19 video series, and we'll be discussing what actions you should take if you suspect you have COVID-19. If you get sick, make sure to check if they are COVID-19 symptoms like fever or cough, or if they're emergency warning signs like difficulty breathing or chest pain. If you have an emergency warning sign, seek emergency medical care immediately. These signs can be found in our first COVID video or online. Most people with COVID-19 will have a mild illness that you can recover from at home without any medical care. If it is not an emergency and you think you are showing symptoms of or may have been exposed to COVID, contact your healthcare provider or a local clinic because you may be able to take a COVID test. In most cases, COVID testing will be free and covered by the federal government, even if you do not have insurance. Be sure to check this ahead of time with the clinic or testing site you plan to go to. Walk-ins may be available, but since COVID cases are spiking higher than ever right now, most sites in the Portland area will only take appointments made ahead of time by phone or online. You should be able to get a test as long as you have probable reason, which is if you're showing symptoms or think you were exposed. You can talk to your healthcare provider or search up COVID-19 testing sites near me online to find out more. So, take a test if you can, and while waiting for the results, quarantine and isolate. Stay home. Stay in a separate bedroom and use a separate bathroom if living with others and if possible. If unable, dedicate a space for yourself with a 6 feet buffer zone between you and others. Clean and disinfect the toilet and sink after you use the restroom. Don't visit public areas. If you have to be around other people or have to leave your isolation space, wear a mask. Wash your hands often. Avoid sharing items with others in your household. Clean high-touch surfaces every day. These are the surfaces that people touch often, like door handles and light switches. Communicate with your close contacts that you may have COVID. This should be your family, coworkers, and people you've seen and interacted with. COVID can still spread 48 hours or 2 days before you show symptoms or test positive. If asymptomatic or showing symptoms, monitor your symptoms closely. Your healthcare provider may ask you about them to check how your body is handling COVID. Again, if any emergency warning signs develop, seek emergency medical care. If you have a positive or a negative test result, wait until symptoms have improved, 24 hours after fever is gone, or 10 days after symptoms first appeared before resuming your regular schedule, whichever is longest. Specifically for the negative result, it means you did not have COVID at the time, but it is possible it was too early to test, and it is also possible for you to still get it after your test. If asymptomatic or not showing symptoms, but believed to have been exposed, for a positive test result, wait 10 days after the test was performed before resuming your regular schedule, as long as you stay asymptomatic. For a negative test result, again, you did not have COVID at the time of testing, but it is still possible. If you had close contact with someone who tested positive for COVID, stay home and away from others for 14 days after the last time you saw them. Do not go to work, school, or any other places until those 14 days of quarantine are up and you have remained asymptomatic. If you are unable to gain access to or receive a test, contact your healthcare provider or a local clinic for advice and recommended actions. You can also contact resident services for help and recommended actions as well. Please email Christopher at Resident Services to let him know you watched this video, so we can enter you into a raffle to win a prize at the end of the year. Also, if you are a BIPOC family who has been affected by COVID in any way, please reach out to Resident Services and they can help connect you to the resources you need, including potential eligibility for a $400 check through a grant they just received. And That's all I have for you today. Unfortunately, this video will be concluding both our COVID-19 informational video series as well as our time here with your community. I sincerely hope these videos have been helpful to you in some way, and we would really appreciate your feedback on how we did this semester. Look out for a follow-up survey that will be sent out to you soon. As always, I'd like to thank the CDC for all the information I presented in this video, and thank you for tuning in. Please be safe, happy, and healthy. We wish you all the best. This has been Bao and Michael from the UP School of Nursing.